Assalamualaikum warahmatullahi wabarakatuh. In this group presentation, we are going to discuss about assignment titled In-Depth Analysis of Sterile Preparation Practice. We are from Group 2 and these are the 8 members in our group.
To start with, in the first chapter, which is Chapter 1, Introduction of Sterile Preparation, I will summarize the key objective and scope of sterile preparation as outlined in this chapter. So the key objective of sterile preparation are for the complete destruction or removal of all microorganisms, including spore-forming and non-spore-forming bacteria, viruses, and fungi that could contaminate the pharmaceutical or other material and thereby constitute a hazard. So this can be achieved through ensuring the patient safety, which is by preventing the microbial contamination in compounded sterile preparation, and also by applying appropriate aseptic technique, facilities, and equipment to maintain the sterility during preparation. So the scope of sterile preparation include aseptic facility, which include design, functionality, and requirement of clean room, buffer areas, anti areas, and ISO classified environment to support the sterile compounding. The second one is the equipment and the engineering control, which is the use of primary engineering control, such as laminar, airflow workbench, biological safety cabinets, and isolator to provide ISO Class 5 environment. The third one is aseptic technique, which is proper handling method, personal hygiene, gowning, hand washing, and non-touch technique to minimize the contamination risk. The fourth one is type of sterile product, such as compounded sterile preparation and pharmaceutical product that intended for terminal sterilization, and also the risk-based approach. In this picture, we can see that the equipment and the engineering controls, which is the first picture, we have the laminar airflow workbench and also the aseptic technique that I mentioned before, which is the full set of gowning and also hand washing. In this part, I will discuss the importance of maintaining sterility in pharmaceutical production. Firstly, sterility is vital to prevent infection and serious adverse effects, since many sterile products such as injection, infusion, and ophthalmic are often administered into the bloodstream, spinal cord, eyes, and mucous membrane. Any microbial contamination may lead to patient harm, sepsis, life-threatening complication, or even death. Secondly, maintaining the sterility can ensure the product quality and therapeutic effectiveness because microbial contamination may cause physical, chemical, or biological degradation of the ingredient of pharmaceutical product that potentially leading to reduce the stability, potency, or formation of toxicity. A sterile product will maintain its intended efficacy throughout its shelf life. Finally, maintaining the sterility is also a regulatory and professional requirement. The use of proper aseptic facilities like hand washing, gowning will validate the sterilization process, and trained personnel is mandated by guidelines such as ASHP guidelines on compounding the sterile preparation. This is an example of sterile products such as injection and ophthalmic solution that may cause serious adverse event. For injection, injectable is more critical because they will enter the body directly and bypassing all the natural barrier, which is it will bypass the skin, mucosa, and the gastrointestinal defense. And meanwhile, for the eyes is highly sensitive and has a limited defense mechanism. So the eyes has no strong immune protection compared to the other tissue. Contaminate eye drop are applied directly to the conjunctiva or cornea, which the microorganism can rapidly multiply in the warm and moist environment of the eye.
In this chapter, I will explain about good preparation practice, which in this part, I will focus on core principle of GPP. GPP is a short term for good preparation practice, which are essential to ensure that compounded medicine are prepared safely, accurately, and consistently, so patients receive the correct dose and quality of medication. Compounding must be only carried out by trained and responsible personnel, such as pharmacy, and they are fully accountable for the quality and accuracy of the final product. Besides, good personal hygiene is very important, and anyone who is sick or has open wounds should not be involved in compounding. Staff must also wear appropriate protective clothing, such as gloves, masks, and hair cover to protect both themselves and the product from the contamination. Compounding should take place in controlled and dedicated premise using calibrated equipment where the area is separated from normal dispensing activity to avoid interruption. Environmental conditions such as lighting, humidity, temperature, and ventilation must be always well controlled, and surface must be non-reactive and safe to maintain product purity. Another key principle is proper documentation, where the detailed records such as the master formula, compounding record, and standard operating procedure must be maintained. The master formula serves as the official receipt that includes ingredients, quantities, mixing instruction, required equipment, storage condition, and quality control steps, while the compounding record documents the specific preparation made, including the date, compounding name, and prescription reference. This ensure the traceability, accountability, and process consistency. Finally, compounding must follow a systemic step-by-step process, including the evaluating, preparing, assessing, packaging, labeling, and reviewing the final product. These photos shows critical requirements for sterile compounding environment, like premises, which is a clean area classification, with seconds about the personnel or specialized competency, the third one about processing or aseptic technique, and last, the full closing, which is a barrier against contamination. Next, for this part, it focuses on how good preparation practice or GPP are applied specifically in sterile product preparation, where the contamination risk must be strictly controlled because sterile products are often administered into sensitive sites such as eye or bloodstream. A key principle is aseptic handling, meaning only sterile tools and sterile solutions are used at all the time, and staff must avoid touching sterile surface to prevent contamination. Sterile compounding must be done in controlled environments such as laminar airflow cabinet, clean room, or other isolated sterile areas. Environment conditions, including the air quality, lighting, temperature, humidity, and ventilation, must be strictly regulated to minimize contamination from microorganisms or particles. The compounding process must follow defined steps, and only one preparation should be compounded at a time to reduce error. The main stage, including evaluation, the preparation, preparing the product, assessing it, packaging, and labeling correctly, and finally reviewing the process and documentation. Proper documentation remains essential, and all the activity must be recorded using the master formula, standard operating procedure, and compounding records to ensure traceability, consistency, and accountability. Quality assurance is also very important, involving routine checks, inspection, and recalls procedures to ensure the product remains safe and complies with regulatory standards. An example of this is the preparation of sterile eye drop, which must be compounded under sterile conditions using proper filtration and then clearly labeled and documented so patients can use them safely. So this is the image that shows the laminar flow hood, including the horizontal laminar flow hoods, vertical laminar flow hoods, plus the standard clean room layout.
The next chapter is cytotoxic drug reconstitution. The first question is describe the standard procedures for reconstituting cytotoxic drug. We have three parts. The first part is pre-production. Before any cytotoxic drug is prepared, several important checks must be carried out. The prescription is reviewed carefully to ensure the correct drug, dose, and patient details. All worksheets and labels are prepared and counter-checked to prevent medication errors. The drugs are checked for correct name, strength, batch number, and expiry date. All materials and equipment are disinfected with sterile 70% alcohol before entering the clean room. The cytotoxic drug reconstitution safety cabinet or isolator is checked to ensure whether it is functioning properly or not. Only trained and validated personnel are allowed to perform this process. These steps are crucial to ensure accuracy, sterility, and safety before compounding begins. Next is during the production. Cytotoxic drug reconstitution is performed inside a certified cytotoxic drug reconstitution safety cabinet or isolator. Strict aseptic technique is maintained throughout the compounding process. The cabinet is cleaned and disinfected before compounding starts. A minimum of 2 personnel are required at all times, one to prepare the drug and another to perform counter-checking. Proper techniques are used when opening ampoules, reconstituting powdered drugs, and withdrawing drug solution. These help to prevent spills, aerosol formation, contamination, and exposure to hazardous drugs. The last part is post-production. After compounding is completed, the safety cabinet or isolator is decontaminated and disinfected using appropriate agents. The finished cytotoxic preparation are labeled accurately with all required information. The products are then packaged, stored, and transported according to the standard operating procedures to maintain stability and sterility. Any rejected or returned products are handled carefully to prevent exposure. All waste generated during the process is treated as cytotoxic waste and disposed of safely according to guidelines. These are picture related to CDR production. For pre-production, we have a picture of CDR safety cabinet. During production, we have a picture of a personnel doing compounding inside the CDR safety cabinet. And for post-production, we have a picture of dispensing cytotoxic waste. The next part is identify the safety measures recommended to protect personnel and the environment during this process. For personnel protection, cytotoxic drugs are hazardous, so personnel must wear appropriate PPE at all times. This includes ASTM T6978 tested glove, impermeable gowns or jumpsuit, head and shoe covers and boot covers. Respiratory and eye protection are used when inhalation or splashing risk exists. Damaged or contaminated PPE must be replaced immediately. For environmental protection, cytotoxic drug reconstitution occurs in dedicated clean rooms to prevent contamination and exposure. Proper airflow, pressure differentials, and controlled temperature and humidity are maintained. Access is restricted to authorized personnel. Routine cleaning, decontamination, and disinfection ensures safe environment. For waste and spill management, all cytotoxic contaminated materials are hazardous waste and must be disposed of separately. Spills require immediate response using a cytotoxic spill kit and following established procedures. All spill incidents are reported and documented for safety quality assurance. For training and health surveillance, personnel must receive initial and ongoing training in aseptic techniques and safe handling of cytotoxic drugs. Health assessments are done before placement, routinely during employment, and at exit. Health surveillance help detect early occupational exposure effects, protecting personnel and ensuring patient safety. Here we have pictures for appropriate PPE and also smart setup for a safer environment and also precaution for hazardous drugs.
Preparing parenteral nutrition is a high-stakes process where precision is non-negotiable. It begins with rigorous verification. Before any compounding starts, every worksheet and label must be counter-checked by a pharmacist. All starting materials from amino acids to dextrose are gathered and double-checked. To maintain sterility, every item is sprayed and swept with 70% sterile alcohol before entering the pass box. Meanwhile, the laminar airflow cabinet is confirmed operational and left to run for at least 20 to 30 minutes to ensure a sterile environment before we start. Once inside the clean room, we follow strict work patterns. At least 2 personnel must be present at all times to counter-check every measurement. Inside the cabinet, we arrange materials linearly, spacing vials and ampoules at least 2.5 centimeters apart to prevent any disruption to the filtered airflow. For small objects, we maintain a 1 centimeter gap or use a zigzag pattern. We use specific technique like the pulse technique for vials and careful swabbing of bunks to ensure every entry into a container is aseptic. The order of mixing is critical for stability. For pediatric bags, we prepare them individually, ensuring the lipid emulsion is infused last. Meanwhile, for adult parenteral nutrition, macronutrients are transferred via a set, while micronutrients are always injected through a 0.2 micron filter. Once the bag is filled, we perform a vital post-production step, which is removing the air. After that, the bag is sealed with a stopper, and a final visual inspection is conducted against light to ensure the solution is free from any foreign particles. Preparing parenteral nutrition is a high-stakes process where precision is non-negotiable. It begins with rigorous verification. Before any compounding starts, every worksheet and label must be counter-checked by a pharmacist. All starting materials from amino acids to dextrose. Here, the laminar airflow cabinet is carefully cleaned to prevent contamination, ensuring a safe environment for sterile compounding. Once prepared under strict sterile conditions, the parenteral nutrition bag is ready for patient use and delivered essential nutrients safely and effectively. To ensure patient safety, we must mitigate 5 critical risks. First, microbial contamination is prevented through annual media fills and sterile disinfectant rotation. Second, we stop particulate matter via visual inspection and adding lipids last. Third, measurement errors are eliminated by mandatory double-checking by 2 personnel. Fourth, we counter a compromised environment by monitoring air particles and pressure differentials. Finally, product instability is managed by strict adherence to beyond use dates. These protocols ensure that every parenteral nutrition bag meets the highest safety standards. Media field tests ensure that aseptic techniques are followed and the environment remains contamination-free. Personnel will undergo glove fingertip sampling to verify proper hand hygiene and sterile technique to maintain a patient safety. Besides that, a mandatory double-checking by at least 2 personnel is performed at all production steps. Verified worksheet and counter-check labels ensure the correct TPN formulation is delivered to the right patient safely.
In this chapter, I will explain about radiopharmaceuticals. Radiopharmaceuticals are sterile compounds that contain radioactive isotopes and are used either for diagnosis or for therapy. Their preparation must be carried out in a dedicated and controlled laboratory area known as a hot lab, where the shielding is used to protect personnel from the radiation exposure. Besides, the aseptic techniques are essential to maintain the sterility and prevent the contaminations. The radioactive compounds are carefully measured, mixed, and dispensed using specialized equipment such as dose calibrator and shielding devices, and the final product must be accurately labeled and dosed according to the patient's prescriptions. During storage and transport, radiopharmaceutical must be kept in the shield container to reduce the radiation exposure, and transport time should be minimized while sterile is maintained until administration. In this slide, it shows the diagram of the radiopharmacy facility layout, including the radiochemistry laboratory, clean room system, and so on. So next, radiopharmaceutical preparation requires patient safety precautions because they involve exposure to radiation. First, personal protection is very important. Staff handling this product should wear a lead, apron, glove, and dosimeter to monitor radiation exposure, and they should minimize the amount of time spent near the radioactive sources. The facility must also be specially designed for radiation safety. This includes the use of shielded walls, fume hoods, and control the ventilation system, and access should be restricted to trained personnel only. Besides, the proper waste management is also essential, as radioactive waste must be segregated and disposed of according to strict regulation. Finally, documentation and compliance are the key. All the procedure, doses, and exposure record must be accurately documented, and staff must follow regulatory guidelines for handling radioactive material at all times. This measure help protect both healthcare workers and the patients while ensuring the safe radiopharmaceutical preparation. Besides, I also prepared the radiopharmaceutical waste image, and you can see the processes that involved in the form of radiopharmaceutical waste. And the second image is about the fume hood design.
Next, Chapter 6, Quality Assurance and Quality Control. According to the manual, quality assurance or QA is a documented system designed to ensure that all sterile products are consistently safe, effective, and of high quality. One important QA measure is personnel validation. All permanent aseptic unit staff must undergo annual validation, including media field testing, which simulates aseptic preparation using growth media, and glove fingertip sampling, which checks for microbial contamination on glove. This ensures staff maintain a proper aseptic technique. Another key aspect is documentation and traceability. Every step of the preparation process must be recorded so that products can be traced if any issue arises. In addition, standard operating procedures or SOPs must be clearly written and followed. These cover critical activities such as training, hygiene, cleaning, and equipment maintenance to ensure consistency. Next, quality control or QC focus on verifying that requirements are met before product release. QC activity must be independent from the preparation process to maintain objectivity. For extemporaneous preparation, routine microbiological testing or media field program are used instead of testing every batch. Finally, all product must be checked and released by a competent person such as the pharmacist in charge. The first picture shows an example of QC reviewing and checking all the materials before the process, and the second image shows an example of glove fingertip sampling. Tests are being done, and the third picture shows an example of documentation logbook in order to find the entries. Next, environmental monitoring. Environmental monitoring ensures that the compounding area remains in a controlled state and sterile state. These include physical monitoring, such as checking air pressure differentials, temperature, and humidity to confirm that engineering controls like HEPA filtration are functioning properly. They also involve microbiological monitoring, using air and surface sampling to detect bacteria or fungi that could contaminate sterile products. The purpose of environmental monitoring is to verify correct aseptic technique, assess the effectiveness of cleaning and disinfection, and allow trend analysis. By monitoring data over time, potential contamination problems can be identified and corrected early. In terms of frequency, physical parameters are checked daily or before preparation. Clean room certification is usually done annually, and additional monitoring is performed after repairs, power failures, or abnormal microbial results. In conclusion, strong QA system and continuous environmental monitoring are essential to maintain sterile conditions and protect patient safety. The first picture shows an example of microbiological monitoring, and the second picture shows an example of trend analysis to check the data over time and the trend of rising contamination and corrected it before major product failure.
Next, the personal training and competency in sterile preparation, focusing on both the training requirements and the impact of continuous education and competency assessment. For training requirement, all personnel involved in sterile compounding must complete initial training before they are allowed to work independently. This initial training must be refreshed at least once every 12 months, and competency evaluations are conducted more frequently every 3, 6, and 12 months, depending on the risk level of the sterile preparations. Training covers several core areas. First, aseptic technique teaches personnel how to work correctly in ISO Class 5 environments such as laminar airflow cabinets and compounding aseptic isolators while maintaining sterility and avoiding contamination. Second, personnel must learn facility and equipment use, including the layout and classification of clean rooms and proper operations of laminar airflow workbenches, biological safety cabinets, and compounding aseptic isolators. They are also trained in proper cleaning and disinfection procedures. Third, hand hygiene and gubbing are essential. Personnel are trained in proper hand washing techniques and the correct sequence of wearing gowns, gloves, masks, and hair covers to maintain sterility. Fourth, staff must understand policies, procedures, and documentations, including following standard operations procedures (SOPs), correct drug handling, accurate calculations, and proper record keeping. For hazardous sterile drugs, training includes safe handling procedures, proper use of personal protective equipment, and correct waste disposal and spill management. In this slide is showing the Kimtech apparel gowning techniques step by step, and also the hazardous drug precautions room sign, which shows the personal protective equipment PPE that should be learned by the personnel. Training alone is not sufficient because skills and knowledge can decline over time and personnel may adopt bad habits. Continuous education and regular competency assessment are essential to maintain high standards. Ongoing training helps reinforce best practices by preventing shortcuts and ensuring staff to stay aware of correct aseptic techniques. It also allows personnel to stay updated with new standards such as USP 797 and 800, emerging technologies, and updated contamination control strategies. Competency assessment, including written tests, practical skills evaluation, direct observation, media field testing, and glove fingertip sampling, verify that personnel can safely prepare sterile products without contamination. This assessment also identify training gaps and provide documented proof of competency. Regular training and assessment have been shown to reduce errors, improve aseptic compliance, and lower contamination risks. They also help foster a culture of safety where staff take accountability for their work, participate in peer learning, and report near misses to improve overall patient safety. Next, we will see a picture of media field test and gloves fingertip sampling as competency assessment, and also a news of emotional intelligence sterile compounding training, which highlight that training and assessing sterile compounding staff competency goes beyond technical skills and may affect the safety outcome.
Next is chapter 8, which is facility design and maintenance. So the first question is describe the key design features of facilities intended for sterile preparation. And the first one is purpose-built sterile facilities. The facilities must be specifically designed for sterile compounding to ensure product quality and patient safety. Then the second one is segregated layout and logical workflow. There must be clear separation between clean and less clean areas. There must also be unidirectional flow of personnel and materials to minimize contamination and crossover. Then the third one is primary engineering control or PECs. There should be use of biological safety cabinets, laminar airflow cabinets, or isolators to provide ISO +5 condition for aseptic processing. Then the fourth one is control clean room environment. Environmental parameters such as temperature, humidity, and air pressure must be controlled. Positive pressure differentials will prevent entry of contaminants from lower grade areas. Then the last one is cleanable surfaces and restricted access. Floors, walls, and ceilings must be smooth, non-shading, and easy to disinfect. And access to sterile areas must be restricted to authorized personnel only. This picture shows clean room and sterile facility layout and laminar airflow hood with biological safety cabinet. Second question is discuss the maintenance protocols necessary to uphold a sterile environment. First one is routine cleaning and disinfection. The cleaning must use sterile, lint-free materials and appropriate disinfectants. And the cleaning must be followed from clean to dirty and top to bottom. And the disinfectant use must be rotated and sporocidal agent must be used periodically. Then the second one is environmental monitoring. There's physical monitoring such as temperature, humidity, pressure differentials, and there's also microbiological monitoring to assess cleaning effectiveness and aseptic practices. Any deviation from specification requires immediate corrective action. Then number 3 is planned preventive maintenance or PPM. There must be scheduled maintenance by hospital support services, include filter replacement, calibration of gauges, alarm inspection, and airflow testing. And there must be annual performance testing and recertification by qualified third-party agents. And number 4 is maintenance after non-routine events. Thorough cleaning is mandatory after AHU breakdown, high microbial counts, renovation or repair work, and environmental parameter deviation. And the last one is documentation and verification. All cleaning, monitoring, maintenance, and recertification activities must be recorded, and the record must be reviewed and verified by the pharmacist in charge. So this picture shows routine cleaning and disinfection, clean room environmental monitoring, and microbiological monitoring.
we move to chapter 9, documentation and record keeping. So for the first question is highlight the importance of throughout documentation in sterile preparation process. So basically, proper documentation is a core component of the quality assurance system in sterile pharmaceutical production. According to the manual for sterile preparation, proper documentation ensure that all sterile preparation activities are performed consistently, traceably, and in compliance with good preparation practice. So there are five importance of documentation. So first is prevention of error. Clear written instruction reduce the risk of miscommunication and human error during the aseptic compound. Second, traceability. Documentation allow every compound sterile preparation to be traced back to its starting materials, equipment used, personnel involved, and processing step. For trade for the third importance is accountability and responsibility. Signed and dated record ensure that each step is verified and approved by authorized personnel, particularly the pharmacist in charge or designated person. Next, regulatory compliance. Documentation demonstrate adherence to GPP, PISC guidelines, and Ministry of Health requirement during the inspection or audits. Lastly, product quality and patient safety. Accurate record support correct release, storage, recall if necessary, and is also allow investigation of deviation, thereby safeguarding the patient safety. For this figure, it shows that a properly completed documentation that ensure testability and accountability throughout the sterile preparation process. This type of record to be maintained and their role in quality assurance. So this record collectively ensure testability, consistency, compliance, and continuous improvement, forming a fundamental component of quality assurance in sterile preparation process. So according to section 2.5, other records, the following record shall be maintained is first is quality control test record. It ensure product meet predefined quality specification before release. Second, monitoring record. It provide evidence that environmental and process parameters are consistently controlled. For the third one is maintenance record. It demonstrates that facilities and equipment are properly maintained to prevent failures and contaminations. Next point is qualification and training record of personnel. It's helped to confirm that staff involved in the sterile preparation are competent and properly trained. So for the 5 points, it's validation records. It provides assurance that process, equipment, and system consistently perform as intended. Number 6 is statistical record. It supports trend analysis and identification of recurring issues or deviations. 7 is distribution records. It ensures traceability of prepared product from preparation to final delivery. Lastly, is investigation and corrective action record, including tracking of event to closure. It ensures duration are properly investigated and resolved to the prevent recurrence. This slide, so I show you some of example. So first, we can see that example of quality control record, and second, we can see the example of monitoring record.
For the last chapter, which is chapter 10, regulatory compliance, I will summarize the regulatory requirement for sterile preparation as detailed in the manual. The first one, the sterile preparation must be compounded or manufactured in controlled environments that meet the specific ISO air cleanliness classification, which is the ISO class 5 condition, which required at critical compounding sites, such as laminar air flow workbench. So the second one is clean area should be ventilated with air passed through an appropriate filter like high efficiency particulate air, which is HEPA filter, to maintain the air quality in the area. The third one, which is the compounding personnel, must be understand, properly trained, and demonstrate the competency in aseptic technique, including correct hand hygiene, gowning, gloving, and non-touch technique, because human activity is recognized as a major source of contamination. Sterile product must be manufactured according to the GMP guideline, which govern the facility design, documentation, validation, and quality management system. For the last one, the use of validated sterilization method, such as terminal sterilization or sterile filtration with defined assurance levels. For high-risk compounded sterile preparation, terminal sterilization is required wherever possible, and filtration processes must include the integrity testing to confirm the effectiveness. In this picture, we can see the HEPA filter shape and also the laminar airflow workbench of the sterile preparation. In the last part, I will discuss the consequences for non-compliance and the importance of adhering to this regulation. The consequences for non-compliance to this regulation are harmful to patients. This results from the failure of maintaining the sterility of product that may lead to the microbial contamination, which can lead to infection, pyrogenic reaction, or permanent injury. Secondly, it can result in product quality failure and recall. This action is met by the regulatory authorities, which resulting in the financial losses and the wastage of resources. Lastly, non-compliance may damage the organizational reputation and the public trust, which result in the long term of confidence in the manufacturer or healthcare facility, which means the patient might not want to buy the product from that company again due to the issue that had happened. So the last one, the importance on adhering to this regulation is to ensure the patient safety and to prevent the harm by avoid the infection and prevent the adverse reaction, especially those with weakened immune system. Next, it is to ensure the medication quality and efficacy by ensuring its purity and maintaining its stability. It is because the sterile preparation must be free from viable microorganisms, and proper condition will prevent the microbial growth that can degrade the drug. For the last part, one of the consequences that I mentioned in the previous part is product recall. Product recall is a removal of a pharmaceutical product from the market because it poses a risk to patient safety and it does not meet the quality standard or violate the regulatory requirements. For sterile preparations such as ophthalmic solution and injection, recall are considered high risk because this product must be sterile and safe. If one of these products is contaminated, it may lead to class 1 recall because this class is the most serious class of recall because product may cause serious adverse health consequences or even death. As example, if the injection solution is contaminated, it may lead to the septic shock, and if the eye drop is contaminated, it might lead to blindness. So ophthalmic and injectable contamination usually fall under class 1. I think that's all from us. Thank you for watching.